So 25% of all diabetics will develop a foot ulcer in their lifetime. 1 in 4 diabetics. I mean, that is so high.
And you did a fellowship with
Dr. Malay.
With Malay, and he is a stickler for data and this stuff. So I imagine you guys looked at a lot of this stuff.
Oh yeah, he's a statistician also.
Yeah, absolutely.
Everyone knows that. So diabetes, huge risk factor for a lot of problems. Obviously, we're talking about foot ulcers here. A big factor in that is that neuropathy component. If you don't control that neuropathy, that diabetes is literally a building block for infection, a building block for peripheral arterial disease, a building block for kidney disease.
And let's clarify a little bit though. You can't really control neuropathy. You can control the glucose, which can lead to worsening of their neuropathy. Can we reverse neuropathy in diabetic patients? I believe in some cases we can, because a lot of times there's an overlying nerve entrapment syndrome, just like carpal tunnel, happening to these folks, and we can address that surgically. 25% of diabetic patients get carpal tunnel, right? And that same, if not even more, are getting nerve entrapments in the lower extremity that are happening on top of whatever metabolic problem they're undergoing. And that's something we can fix surgically. So if we can identify that subset of diabetic neuropathic patients, most of them are having pain, then we can decompress those nerves, improve their pain, but at the same time, make a huge impact on their risk for ulceration, probably dropping it down to 3 to 5%.
Isn't there a couple of studies? I know that you're the study guy on this stuff.
Yes, and there's a massive database that Lee Dellon helped put together with his Institutes of Peripheral Nerve Surgery, where the majority of those of us who were doing this type of work were plugging patient data into this huge database. It's retrospective, it's not prospective, but it shows even in those patients that we are referring to people who do this stuff for a living, these wounds are really hard to heal, number one, and we can make a huge impact on their recurrence or the recidivism of these wounds by decompressing their nerves. And that, I think, is worth its weight in gold, because it's the recurring wounds that are costing lots of money and eventually leading to infection, osteomyelitis, amputations. So
and then aside from diabetes, peripheral vascular disease with diabetes increases that risk 5-fold. I mean, that is huge, and that is a big reason that why we work so closely with our vascular colleagues.
Well, and why we also hammer people about smoking and diabetes.
Oh my God, yeah.
Smoking by itself is bad enough, but when you add diabetes on top of that, boy, you're asking for trouble. It's really, really hard.